Coronavirus is a large virus family that exists widely in nature and is named for its crown-like appearance when observed under an electron microscope. It mainly causes respiratory diseases among patients. 7 types of coronaviruses have been found with infectivity in humans, of which SARS, severe acute respiratory syndrome, MERS, Middle East respiratory syndrome, and the novel coronavirus can cause serious human diseases. Other than humans, coronaviruses can also infect such mammals as pigs, cattle, cats, dogs, bats, mice, hedgehogs, as well as birds. The novel coronavirus refers to a new coronavirus strain that has never been found in humans before. The virus responsible for the outbreak of viral pneumonia in Wuhan in December 2019 is this new strain, which has been named 2019 nCoV by the World Health Organization. The novel coronavirus can be spread by human-to-human transmission. According to health and epidemic prevention experts, the virus can be transmitted through droplets, contact, and aerosols. Generally, they are individuals who have had close contact with patients, suspected or confirmed cases, such as taking the same transportation, sharing a classroom, and sharing the same living space, but have not taken protective measures, such as wearing a mask. According to the current understanding of pneumonia caused by the novel coronavirus, the maximum time from viral exposure to the onset of symptoms is 14 days, so close contacts are subject to a quarantine period of 14 days. The symptoms are mainly fever, fatigue, and a dry cough. Some patients will have trouble in breathing after 1 week, and in severe cases, it can quickly progress to acute respiratory distress syndrome. Some patients may experience mild symptoms without fever, and a minority of patients might fall seriously ill and even die. Contrary to expectation, it's rare for the virus to cause nasal congestion, runny nose, and other upper respiratory symptoms. Many respiratory diseases have symptoms such as fever, fatigue, and dry cough. Diagnosis requires a comprehensive medical examination based on pre-onset activity, whether there has been exposure to suspected patients, and laboratory test results. Therefore, should symptoms of novel coronavirus infection appear, such as fever, fatigue, cough, and phlegm, please do not panic. Take protective measures and seek urgent medical attention. Tell medical staff about your personal travel history over the past 2 weeks and people you have been exposed to, so that doctors can perform a swift diagnosis. If you have been in contact with people you suspect are infected with the novel coronavirus, you should first wear a mask and avoid any further close communication. Recommend they wear masks and go to the nearest designated treatment hospital for prompt examination. The clinical manifestations of flu include high fever, cough, sore throat, and muscle pain, but pneumonia is uncommon. Symptoms of the common cold are nasal congestion and a runny nose. Most patients have mild symptoms and generally do not show symptoms of pneumonia. The main symptoms of novel coronavirus infections are fever, fatigue, and a dry cough. Pneumonia may also develop. However, it is worth noticing that early-stage patients may not have fever and only show the symptoms of chills and respiratory infections. However, pneumonia can be seen on CT scans. The novel coronavirus is a new strain able to cause pneumonia, meaning there is a general lack of immunity among the population and are therefore susceptible to infection. The elderly and those with pre-existing conditions are more at risk from infection. Children and infants are also prone to infection. A. Avoid travel to epidemic-prone areas and minimise contact with people returning from epidemic-affected areas. B. Avoid unnecessary travel to crowded places, indoor public areas, and wherever people with low immunity gather, especially young children and the elderly. If you have to go out, you must wear a mask. C. Open windows for better ventilation, as good air circulation can effectively prevent respiratory infections. When opening windows for ventilation in winter, be aware of large differences between indoor and outdoor temperatures, which may lead to a cold. D. Wash your hands frequently. Wash your hands with running water and soap or hand sanitizer for at least 20 seconds. If there is no opportunity to wash your hands, use alcohol-based rinse-free hand sanitizer. E. If fever, especially when high fever persists, cough, shortness of breath, and other symptoms of respiratory tract infections appear, You should wear a mask and seek medical treatment immediately. When coughing and sneezing, droplets containing viruses can be spread into the air to a distance of about 2 meters, and people around you can be infected by inhaling them. So please pay attention to A. Covering your mouth and nose with a tissue or elbow when sneezing or coughing, and not with your hands. B. Putting tissues used for sneezing and coughing in a covered trash can. C. Washing hands thoroughly with soap or hand sanitizer after sneezing and coughing. For daily protection, medical surgical masks are a good choice. They are thin, but can effectively block the transmission of viruses. N95 masks are better for disease prevention, but they are restrictive to breathing and less suitable for long-term usage. The presence or absence of a breathing valve on the mask does not affect the level of protection. Masks made of cotton gauze or sponge may retain more warmth, but do not protect against viral infection. Masks made at home are not reliable. A. If the mask becomes wet or contaminated with secretions, it must be replaced immediately. B. When removing the mask, try to avoid touching the outer surface. Do not touch masks used by others to avoid cross-infection. Don't place used masks casually. Put them directly into your bag or pockets, as they may cause infection. C. Scalding with hot water, burning, cutting, and throwing away are not recommended methods for disposing of worn masks. D. Masks used by members of the public can be thrown directly into the trash. E. For people suspected of having an infectious disease, they should hand over the used masks to staff when seeking treatment and should be treated as medical waste. F. After handling masks, remember to wash your hands with running water and soap. Wash hands before meals, after using the toilet, after returning home, handling garbage, and contact with animals. Clean hands thoroughly with running water and soap or hand sanitizer for at least 20 seconds. Do not buy or consume wild animals. Limit exposure to seafood, poultry markets or farms, and avoid contact with wild or farmed animals. Ensure that all kinds of meat and eggs are thoroughly cooked. Cutting boards and knives used for raw foods should be kept separately. Maintain a reasonable diet and ensure balanced nutrition. Ensure the diversity of food and find a balance between whole grains, refined grains, meats and vegetables. Eat fresh fruit and vegetables as much as possible. Supplement vitamins and cellulose, and drink plenty of water. Elderly people are susceptible to the novel coronavirus and should avoid exposure to crowded public areas and reduce unnecessary social activities. Masks should be worn before going outside and hands should be washed frequently. Although only a few children have been diagnosed with the novel coronavirus to date, they are still a key demographic in need of protection. While washing hands frequently, limiting the frequency of going outside, wearing masks and regular ventilation, relatives and friends should be advised to avoid close contact, such as kissing and playing with children, especially infants. Children should maintain a healthy and regular lifestyle by going to bed and getting up early and not overeating. It is recommended that children under the age of 3 do not wear a mask and should be protected by reducing the time spent outside. A. The novel coronavirus is sensitive to heat and can be destroyed when temperatures are maintained at 56 degrees Celsius or above for 30 minutes. Multiple disinfectants such as chlorine, ethyl alcohol, iodine and peroxide can also kill this virus. B. After returning home, hands should be promptly washed and disinfected by running water and hand sanitizer. Hands and skin should be disinfected by 75% ethyl alcohol, iodophor and other disinfectants. C. The solution, with an effective chlorine concentration of 250 to 500 milligrams per litre, prepared by chlorine disinfectants such as 84 disinfectant and bleaching powder, can be used for disinfection of the house environment through wiping surfaces or soaking. D. Try to wash towels once per day. Frequently change and wash sheets, quilts and clothing. Dry them at high temperature if possible. Cups, tableware, etc. should be disinfected after use by using sterilizer or putting them in boiling water for 15 minutes before cleaning them with running water. A. When symptoms appear amongst family members, everybody should take preventative measures and arrange travel to a hospital as soon as possible, avoiding public transportation. B. After sending family members with symptoms to hospital, their room and whatever they have been in contact with, such as the floor, bathroom, furniture surface, door handles and tableware, should be disinfected. Thorough disinfection should be carried out on floors, walls, furniture surfaces such as tables, chairs, door handles, daily necessities such as tableware, crockery, clothing and bedding, toys and toilets. Terminal disinfection of this type is usually carried out by professionals. Please contact your local CDC for details. Other family members and other close contacts should receive medical observation for 14 days.